Virtual health has been a huge boon for those with different labor unions. If you think about the fact that quite often people who may have an office job, if you have a doctor's appointment, you just take a couple hours off in the morning. You can't do that if you're driving a package truck and you've got to make 115 deliveries by 6 p.m. So it really has opened up access to care. So for me, the big thing for the people that we work with, our population, is having available access to medical services, which they really otherwise wouldn't have. Really proud of the fact that benefit design nowadays is able to do what all of healthcare needs to do, which is meet people where they're at. You can have great programs, you can have great ideas, but if your people can't access them, and if you're not able to reach a patient where they are that day, then you're going to miss the mark, you're going to waste care, you're going to waste, to be honest, you're going to waste benefit dollars. So what we found is being able to connect patients with the proper provider at the proper level of care that they need at that time is a huge win-win for the patient and also for the benefit plan. You've heard the phrase food desert, where certain communities don't have access to quality food. Well, likewise, there's care deserts. There's so many areas. It doesn't have to be rural. It could be in a city where one side of the town has all the services and the other side doesn't, and there's poor transportation between those 2 points. What we've really found in our referrals that we make is virtual care has allowed us to find that specialist 5 towns away, to find that specific service that the patient who may not have a car can get to now by using telehealth. It's important to remember that not everyone has access to stable transportation. And it's really important to understand that that person, despite not having a car or access to a car, still has needs. And so by using virtual health to connect that person to the solution that they need in the comfort of their own home, without having to worry about the 2 buses or the subway or whatever they need to take, plus the cost for all that to get there, you are really opening up the treatment options for everybody. You know, we've worked with Teladoc for many, many years, and as far as I know, Teladoc is really the only company that has a 20-year history of providing services and being in this space of virtual health. And that just puts them so far ahead from other providers. They've got the providers, they've got the systems, and over the years have continued to refine and improve the way that they deliver care. And to me, that's a huge advantage. One big demographic of labor unions is that the members tend to be with you for 20, 30, 40 years. So it's really important as a plan sponsor to keep that group as healthy as you possibly can, because the person that you have right now is 24 is probably going to be with you at 64. So it's really important to be able to get them services immediately. Also, just the union environment this is our group, and as union leadership, we care about you. It's really important for union leadership to give that message of we're here for you, this is a brotherhood or sisterhood, and we're all looking out for one another.